This young man has now been arrested, charged with murder. What stands out from what we've learned?
For me, the biggest thing is the manifesto, because when you're talking about charging someone with murder, particularly the higher degrees of murder, you need to be able to show intent. Oftentimes, as a prosecutor, you're not able to do that because you have to get into the mind of the accused. And in this case, you have a manifesto that's laying out his grievances and his gripes with corporate America in a way that's going to make it a lot easier for prosecutors to move forward, presuming that everything about this investigation has been up to snuff. All the I's are dotted, all the T's are crossed. That's important in an investigation like this because you've had the coordination of multiple law enforcement agencies that have been involved with the apprehension of this individual. And so when you have those many different hands in the pots, things can get messy. But assuming that that's not the case, that manifesto is going to be key. Also, the fact that the presumed murder weapon was still on him a week later. So prosecutors have multiple avenues that they can move forward with respect to presenting a strong case and getting a conviction around murder. But to me, those two things are going to be paramount.
Dan Diamond, you don't just cover the healthcare industry. You went to the same school as this young man in Maryland, the Gilman Boys School. You went to University of Pennsylvania, the same undergrad degree he just got. What did you learn in the last few days about this man's family? I mean, quite prominent in Maryland.
Well, first, I'll just say that my mind has been boggled. I've been following a United Healthcare case since last week. And Steph, I worked for a company that was acquired by United Health, so I know people who know Brian Thompson quite well. Luigi Mangione was described to me by teachers, classmates that I talked to today as someone who's incredibly bright, charismatic, a leader, someone who's very positive in high school and seemed to have the whole world at his feet when he went off to college. But there was a turn these past couple of years, and we're still reporting on exactly what happened. But his life very much changed, and he dropped off the grid and was unknown to his friends these past couple of years.
Why?
It seems it may have been connected with an injury that he had to his back. Again, we're still reporting, we're still learning exactly what happened. But there are some indicators from what he was reading on the Goodreads account that he was reading things about how to get his back healthy again. There may be some indication in some of his posts that he was dealing with some health issues and may have taken some anger out on the healthcare industry as a result.
More than taken anger, potentially. Charles, here's what I do not understand. This happened 5 days ago. Sure. There weren't a lot of photographs of him, but there was definitively a photograph of this young man's face last week. He went to high school less than 10 years ago. He went to Penn less than 5 years ago. How is it that no one in this entire country, it was a McDonald's employee in Altoona, Pennsylvania, that said, I think I recognize this person, yet no one he went to school with in the last 10 years said, I know that face?
I'll do you one better. I have a bigger question. The New York Police Department has a $6 billion budget. There are cameras everywhere. Why is it that it took us so long to get a clear picture of this man's entire face? I think that...
Well, maybe he always had the mask on.
Well, the mask thing, and so to me, that's part of the answer to your question in terms of why we didn't get an identification sooner because of the mask and because he was walking around with it. But for me, I had been wondering, there has to have been somewhere, somehow, that this man was spotted without that mask in a photograph that may have been released, or why did it take so long for us to get one? Now, we got two from inside a taxi cab and adjacent to a taxi cab, and that ultimately was what gave us the full description. But that leads me back to what you asked, which is, once those photos came out, how is it that it took so long to identify this person to the point that he had left New York State? I am boggled by all of these things. I'm troubled by all of these things because of the size, the budget, the scope, and the reach of what NYPD is supposed to be able to do with technology. Ultimately, is it going to play a role in damning the case or the prosecution? Probably not, but it is something that should be of significant concern.
Dan Diamond, let's talk about United Healthcare. Brian Thompson specifically, he was actually under investigation for insider trading. And I want to be clear, in asking you about Thompson and United Healthcare, I'm not condoning or celebrating in any way any violent actions against him. But, you know, we just keep hearing in the last week, that company sucks, they suck, this person potentially deserved blank. We're not going there. But I do want to understand what's going on at this company and who this person was.
I agree, Steph, that you can walk the line of talking about the problems at United Healthcare while mourning the violent death of Brian Thompson. United Health Group is the biggest healthcare company in America. By revenue, it's the fourth largest company in America. United Healthcare is its insurance arm. It covers about 50 million Americans, some through the Medicare Advantage program, some through Medicaid managed care, many through employer health insurance. And it also, United Health Group, the parent company, employs about 1 in 11 doctors, or if not employees, has them affiliated as well. This is a company that touches all parts of healthcare. There is a lot of anger as a result from people who have had bad experiences with United Healthcare across its various arms. Specifically, many patients have had claims that were denied. They've had to go through the prior authorization process where a physician might have said, you need this procedure, and United Healthcare found ways to slow walk that, delay the procedure, deny the procedure, and ask for more paperwork. So there's a lot of anger toward this company that goes well beyond any individual.
Dan, you cover business. How bad has the healthcare industry become for consumers?
Well, it's pretty simple. I mean, if you have anybody with a chronic health issue in your family, you kind of realize
a huge portion of the people in this country.
So you kind of recognize some of the anger, right, that you're seeing. And so this is an industry that is amazingly profitable, right? So if you're looking at it through the lens of the stock market, a lot of these companies have done very well. They've taken out some of their competitors. There's been a lot of consolidation. That means that they have a lot of pricing power. You also think about, we've been talking a lot about generative AI.
Pricing power, meaning they can charge whatever the hell they want. Correct. And people have no choice.
And it's not particularly transparent, right? So now you add on this other layer. People are trying to find use cases for generative AI. One of the probably best sort of businesses to do that would be in a high data business like, health insurance. There's other things in banking. So when you think about people who have claims for their insurance company, it's a very personal thing, right? And the actual response that you're getting is very impersonal, right? So one of the things that you talk about, striking a chord with a lot of consumers who pay a lot of money. Insurance costs have been going up dramatically over the last 20 years or so.
And there's nothing you can do about it.
There's nothing you can do about it. So when you get this sort of treatment, you understand the frustration that many folks are feeling. But through the lens of business, I'll just add one other thing here. I think a lot of CEOs, a lot of managements are very nervous about this, right? When you think about, there was an assassination attempt on somebody running for president almost 2 times, right? So now you start taking out CEOs of companies that you don't agree with their business practices. I'll just give you one anecdotal situation. My office is in the office of Palantir. This is a company that's a defense contractor, $165 billion market cap. I saw the CEO walking into our building last week, right after this incident, flanked by 2 security people. So you're going to get a situation where a lot of folks are really nervous about their own positioning and where they go. And then the other thing is you're going to lose transparency for a lot of these companies, right? Because they're going to be less inclined to share things about their businesses. So I think there are some knock-on effects from what happened last week.
We're seeing companies panicked right now, right? Security firms can't even find security guards to deploy for businesses out there. But what happened? What changed? What went from this company's corrupt, this company's awful, that CEO deserves a pay cut, they deserve to be fired, and someone getting assassinated on the street?
It's not too different than the frustration that a lot of Americans felt about inflation, right? So some of the areas that inflation has not been coming down, is insurance. And you're seeing it in auto insurance, you're seeing it in life insurance, you're seeing it in health insurance. So that's one of the things that touches everyday Americans. And so, when you think about it, I mean, we are not done with this inflation trade. And one of the things I think is sticking out like a sore thumb is health insurance.
I want to share something Pennsylvania Governor Josh Shapiro said earlier tonight, really his message to those who are sort of openly praising and glorifying murder. Watch this.
Violence can never be used to address political differences or to address a substantive difference or to try and prove some ideological point. That is not what we do in a civilized society. That was true in Butler. It was true in New York City. And it's true anywhere. That is not how you make progress in this country.
Charles, do you think people are hearing that message?
In theory, yes. In practicality, no. Because you can't talk about what we do in a civilized society when you have people who are struggling and fighting to buy insulin and other life-saving drugs that they need.
And there's no one they can even get on a phone.
That's correct. And so when you can't get anyone on the phone and you're not sure whether you're going to get the drugs that you need to in order to just simply keep yourself alive, that level of corporate greed that you're contending against, when you don't feel like you have any other outlet or any other vehicle through which you can fight back, that's a very hard sell for anyone to sort of reconcile within themselves. And so I think it's fine, well and good that the governor says, hey, this is not what we do. Well, then what do we do?
The governor's saying this isn't how we behave in civilized society.
Correct.
And those people are saying denying me life-saving drugs
Absolutely.
is not how civilized society operates.